WA is in the grips of a fresh measles outbreak with another 4 cases recorded in the Pilbara. AMA WA President Dr Kyle Hoath joins us. Thank you very much for coming in. Firstly, how infectious is measles?
Yeah, look, measles is very, very infectious, so it can be spread by droplet. Even if you enter a room 30 minutes after somebody was in there, you can contract measles. So, look, we are concerned it's a very contagious disease that has the potential to spread quite rapidly.
And almost a dozen new exposure sites have been added to a growing list. So how concerned are you about the spread of this disease?
And we are concerned because of that level of contagiousness, but being able to know where these sites are, having those listed and being on the front foot with testing and exposure sites listed is really important. Let's
talk about that, because WA has recorded its highest number of measles cases in more than 6 years. We've got 43 cases and only 16 cases were recorded altogether over the past 5 years. So why the surge?
Yeah, there are a number of factors, but the most alarming one is the drop in vaccination rate for measles. So it doesn't take much of a drop in the vaccination coverage for little pockets of infection to start to occur. So although we've had some imported cases and some are travel related, there are pockets of low immunity that have led to this little outbreak.
Is that the only way to stop it, vaccination?
Vaccination is our best defence against measles. Preventing spread, staying at home if you're sick, certainly for our FIFO workers, not getting on the plane if you're showing any symptoms and have been at those exposure sites. But the number one way to tackle this is immunisation.
Let's just explore that a bit further. That is your message to FIFO workers and also to locals, just stay at home.
Yeah, look, if you're sick and you've got any symptoms of measles, particularly in that 7 to 18 day period after possible exposure, you need to go to a testing site, mask up, stay home and get some help immediately, because that will prevent the further spread and prevent it from becoming a much bigger outbreak.
Who's most at risk?
Typical, so our young and our elderly, as well as our pregnant and immunocompromised patients.
And what do they need to know about the disease? What should they look out for to know that they are in fact infectious?
Yeah, like I said, the sort of peak symptoms are normally around the 10-day post-exposure. It starts with your sort of typical runny nose, sore throat, fever, but you'll develop a red blotchy rash that sort of starts on the face and the neck and then generally spreads down from there. If you have any of those symptoms, in particular any rash in that kind of window, and you've been near any of these exposure sites, it's absolutely crucial that you get to a testing centre.
Dr Hoath, appreciate you being with us.
My pleasure. Thank you.